So the research itself is part of a bigger project to try to understand the specificities of stroke and other cardiovascular or cerebrovascular diseases in ethnic minorities that have been really understudied in all aspects of research. So we wanted to specifically investigate or find out if what is commonly referred to as the coronary artery disease paradox is a true difference between white people and other ethnic minorities, or if it is just a consequence of a bias in terms of access to healthcare or reporting of diseases or even willingness to participate in research. So basically, the coronary artery disease paradox was defined in the US as this observation that people from ethnic minorities have a higher burden of vascular risk factors, hypertension, diabetes, obesity, but they paradoxically have a lower incidence of obstructive coronary artery disease, which means myocardial infarction, cardiovascular death, and so on. So the hypothesis usually given to explain that is that in the US, because Black people have lower access to healthcare, this might just be diagnosed less often underreported. So we thought that if the hypothesis is true, if we look at data in the UK where access to healthcare is more equitable due to the NHS, which is National Health Services, really at the point of access, we shouldn't observe the same difference. But if we observe the coronary artery disease paradox, it would mean that potentially there is something to find in the susceptibility aspect of the disease. So to investigate that, we went to look at the data from the Oxford Vascular Study. So it's a study, prospective cohort study that recruit all patients with suspected acute stroke in the UK and follow them up to identify or to record their outcome, but also systematically record data from about their risk factors or past medical history using various sources or record linkage. So in that data set, we had approximately 7,000 people, including about 300 people from ethnic minorities. And what we found is that people from Black people had approximately 70% less coronary artery disease or history of coronary artery disease compared with white people, while there was no difference between Asian people and white people. So, and when we did adjusted analysis, because one concern in previous studies is that they are reported unadjusted analysis, but when we did adjusted analysis, adjusted for all the other risk factors, smoking, age, hypertension, diabetes, atrial fibrillation, we found that this difference was, or the odds ratio was 0.5, meaning that Black people are approximately 50% less likely to have coronary artery disease when compared to white people. And this magnitude of this difference was confirmed in a meta-analysis where we included not only OxVasc data, but also data from other studies that have been published on the topic in the UK, including data from the South London Stroke Registry. So in conclusion, we think that the coronary artery disease paradox is a reflection of a true biological difference between Black people and white. And in the future, we need to investigate this further to understand the mechanisms. So this implies that studying ethnic minorities more often or more inclusive, more including them in trials or in research could help find out mechanisms that lead to lower susceptibility to coronary artery disease, which would in turn benefit for white people too, because if we find the mechanism, we can apply it to all.